Hello friends, welcome to today's episode of Masters of Public Health, and I'm your host Dr. Pranav, HOD Department of Public Health. Today's topic is about National Family Health Survey, and it is one of the very important survey conducted across India and different stages to find out the state of health in Indian population. And the results which have been published recently is of great use for all the public health scientists, and as I keep saying, for everyone for whom health is important. And yes, health is important for each and every one of us. So the first important highlight, which is a very good news, is that India's population has almost stabilized and now it is kind of declining. To define the rate of growth of population, we use two different indices. One is total fertility rate. This is the number of children a woman is expected to deliver in her reproductive life, and now it has reduced to 2. It has reduced to 2 from earlier survey when it was conducted, it was 2.2. So now we can safely assume that India's population will gradually decline from this point. Though it is not the same for all the community divided on demographic parameters, like across the community for different states, Bihar, Uttar Pradesh, Jharkhand, Meghalaya and Manipur, these 5 states population is still increasing. The total fertility rate is still high. If we talk about the religious community, almost all the communities are now facing a reduction in population. The total fertility rate has reduced to less than 2.2, except Muslim population, which is still growing at the rate of 2.6. Now, the second indices which is used to explain the rate of growth of population is the replacement level fertility. That is the level of fertility at which, if population grows, it will not increase but it will kind of stabilize at the same level, unless and until it is affected by migration, like people moving from one country to another country. So this replacement level fertility is considered 2.2. So now in India, every single religious community is facing less than 2.2 level of fertility, except, as we discussed, the Muslim community, which is facing 2.6 total fertility rate. Apart from that, if we talk about underage marriage, so it is still prevalent in West Bengal and Bihar. But the good news is now the teenage pregnancy rate is declining, and now from earlier survey it was 7.9. Now from 7.9 it has reduced to 6.8. So here also we can see there is a positive change and there is a reduction in rate of teenage pregnancy. Now talking about the level of immunization, another good news for the population of India. Now our children are getting more and more immunized, and now the level of immunization is roughly around 77%. That means more than 3/4 of our children are now fully immunized. So that's again one of the big success story which is not being highlighted, and as citizens of India we are supposed to celebrate, because now our expectation is our children are at least being protected against the diseases which has got immunization available. Now talking about a little bad news, and the bad news is we are getting more obese as country. From earlier rate of 21%, now the obesity rate is 24%. So almost 1 out of 4 person in India is obese. This is something of a challenge, something of an alarm. As citizen and as public health scientist and healthcare worker, we should take it very seriously. We should spread the communication, we should talk to people, we should talk to community, and we should promote right weight, because right weight only is going to give us a long and healthy life. Now talking about another good news, that stunting, that is the growth of children getting stunted, compromised, so this rate also is reducing. Earlier it was 38%, now there is this marginal decline, so now only 36% of children are facing stunting of growth. But as aware citizen, this is still something we cannot really feel proud. So overall we can see that National Family Health Survey suggests a good picture. Our population is now under control, almost on the verge of decline, but we have some of big challenges still there, like the 23% of population of children which are not fully immunized. We have to take care and we have to bring them to the immunization center, and we have to curb obesity, because obesity is going to make our India not so healthy. So that is all from this news bulletin on National Family Health Survey. We'll meet again. Thanks a lot. Thank you.